Keloid scar is made up of dense collagen. Primary closure of incised wound must be done within 6 hours. The tensile strength of wound reaches that of normal tissue by none. The worst position for scar is sternum. The best scars are seen in very old people. Patient has lacerated untidy wound of the leg and attended the casualty after 2 hours. His wound should be debrided and sutured secondarily. Following are required for wound healing except. So what is required is zinc, copper, vitamin, calcium. All are required. Wound healing is worst at sternum. When is the maximum collagen content of wound tissue? Between 17 to 21 days. If suture marks are to be avoided, skin suture should be removed by 1 week. What is true about keloids? It appears a few days after surgery. Keloid is best treated by intrakeloidal injection of triamcinolone. A patient with grossly contaminated wound present 12 hours after an accident, his wound should be managed by thorough cleaning with debridement of all dead and devitalized tissue without primary closure. Delayed wound healing is seen in all except. So delayed wound healing is not seen in hypertension. It can be seen in malignancy, diabetes and infection. The following statement about keloid is true. Local recurrence is common after excision. Fibroblast and healing wound derived from local mesenchyme. In the healing of a clean wound, the maximum immediate strength of the wound is reached by 13 to 18 days. Management of an open wound seen 12 hours after the injury is debridement and suture. Degloving injury is avulsion injury. The best cure rate in keloid is achieved by excision and radiotherapy. A clean incised wound heals by primary intention. In treatment of hand injuries, the greatest priority is the restoration of skin cover. During the surgical procedure, nerve should be repaired before tendons. Limb salvage primarily depends on vascular injury. In an open injury, toileting and debridement muscle viability is detected by color of the muscle and muscle contractility. All of the following favor post-operative wound dehiscence except. So, favor post-operative wound dehiscence are malignancy, hypoproteinemia, and jaundice. Which does not favor is vitamin B complex deficiency. The tensile strength of the wound starts and increases after 3 to 4 days. Prevention of wound infection is done by pre-op antibiotic therapy, monofilament sutures, and wound apposition. Abbey-Esclander flap is used in reconstruction of lip. The vitamin which has inhibitory effect on wound healing is vitamin E. Elective cholecystectomy is clean contaminated. In a sutured surgical wound, the process of epithelialization is completed within 48 hours to 72 hours. Which one of the following surgical procedures is considered to have a clean contaminated wound? Elective open cholecystectomy for cholelithiasis. Fibroblast and healing wound is derived from local mesenchyme. Reactionary hemorrhage occurs within less than 24 hours. Which of the following is not absorbable suture? Polyester is not absorbable suture. Catgut, polyamide and polygalactyl are absorbable suture. All of the following statements about necrotizing fasciitis are true except. So what is true is infection of fascia and subcutaneous tissue, most commonly caused by group A beta hemolytic streptococci. Surgical debridement is mandatory. What is false is most common site is perineum followed by trunk and extremities. True about wound healing is deep dermal wound heal by scar formation. Wound contraction is found in healing by secondary intention. Which of the following is a scoring system for severity of wound infection and is particularly useful for surveillance and research? Southampton grading system. Which one of the following organism is not associated with synergistic gangrene? Escherichia. True about not associated with synergistic is Escherichia, while associated is Staphylococcus, Clostridium and Peptostreptococcus. True about chronic wound is found in diabetes mellitus, may associated with vascular compromise, and monofilament sutures prevent infection. Any wound that does not heal within 3 months is chronic wound. Chronic wound does not always require surgical treatment. Conditions associated with panniculitis is pancreas cancer, acute pancreatitis, and pancreatic divisum. Which of the following is a non-absorbable suture? Polypropylene is a non-absorbable, while catgut, polygalactin, and polydioxone is absorbable. Hypertrophic scar is characterized by following except. So it is non-familial, it involves the flexor area, it is not related to the race. And what is not true is it outgrows the wound area. That is not true. Match the list. List 1 is of agent and list 2 with example. So polymeric film is opposite tegaderm. Debriding agent streptokinase is benzoyl benzoic acid. Biological membrane is porcine skin amnion, and enzymatic agent is Vandase. True about surgical wounds is no antibiotics required in clean surgery. Spillage of stomach contents convert a clean contaminated case to a contaminated case. In clean or contaminated wounds, infections rate is 10%. Tidy wounds inflicted by sharp instruments and containing no devitalized tissues are expected to heal by primary healing. Tissue suturing glue contains cyanoacrylate. Z-plasty ideal angle is 60 degrees. Fluid and electrolyte. Complication of total parenteral nutrition include hyperglycemia, hyperkalemia, and azotemia. The highest concentration of potassium is in Darrow's solution, which does not occur in the first week of IV hyperalimentation. Weight gain does not occur. Uremia, jaundice, and ketosis can occur. Pitting edema indicates an excess of 4.5 liters of fluid in tissue spaces. In patients subsisting entirely on parenteral fluid, there is weight loss of 150 gram daily. Condition which does not cause metabolic acidosis. Pyloric stenosis does not cause metabolic acidosis, while renal failure, uterosigmoidostomy, and pancreatic or biliary fistula can cause metabolic acidosis. Albumin infusion for parenteral use is restricted because it is costly. Following total parenteral nutrition, one expects weight gain after 7 days. Following fistulous conditions give rise to maximum fluid and electrolyte imbalance, duodenal. The minimum amount of proteins needed for positive nitrogen balance is 60 gram per day. Highest concentration of potassium is seen in colon. Deficiency of following elements is seen with hyperalimentation except. So deficiency of calcium, phosphate, zinc, and magnesium all is seen in hyperalimentation. Hypochloremic alkalosis is a complication of congenital pyloric stenosis and vomiting. The disadvantage of alimental diets in children include hypertonic dehydration and dumping syndrome. 20 millimole of potassium chloride in 500 ml of 5% dextrose solution is given intravenously to treat metabolic alkalosis. Hemocele contains degraded gelatin. In the immediate post-operative period, body potassium is excreted excessively. Low molecular weight dextran is contraindicated in thrombocytopenia. The commonest cause of metabolic alkalosis is pyloric stenosis. Commonest cause of metabolic alkalosis in surgical patient is gastric outlet obstruction. Hyponatremia in multiple myeloma is pseudo. During nutritional assessment of a surgical patient, the status of muscle protein is indicated by which one of the following parameters? Mid-arm circumference. Central venous pressure and pulmonary wedge pressure give an accurate assessment of all the following except. So it gives accurate assessment of volume depletion, volume overload, and myocardial function, but it does not give an accurate assessment of tissue perfusion. In a case of acute trauma, best guideline for quick replacement of fluid is urine output. All of the following are indications of total parenteral nutrition except. So indicators of total parenteral nutrition is postoperative ileus, enterocolic fistula, acute pancreatitis, and enterocutaneous fistula. In a patient with multisystem trauma, the presence of hypotension along with elevated central venous pressure is suggestive of cardiopulmonary problem. Following total parenteral nutrition, weight loss is seen up to 7 days. Which of the following is the best method to assess the adequacy of replacement increase in urine output? In a person who has fasted for 5 days, all are seen except. So a person who has fasted for 5 days, glucose tolerance is decreased, immunoreactive insulin is decreased, free fatty acid is increased, but GH level is also increased. They are not decreased, or they may be normal or increased but cannot be decreased. Content of sodium in ringer lactate is 130 milliequivalent per liter. Body water content and percentage of body weight is lowest in fat women. Fructose is not used in IV infusion as it causes none. It does not cause irritability, mental retardation, or increased erythrocyte protoporphyrin or increased urinary coproporphyrin. Water content in infant is 75 to 80%. Insensible daily water loss is 800 to 1000 ml. Sodium content of 1 liter of isotonic saline is 154 milliequivalent. Total parenteral nutrition may be complicated by hypercalcemia. Blood loss during major surgery is best estimated by suction bottles. Persistent vomiting in GOO, that is gastric outlet obstruction, causes hypokalemic metabolic alkalosis and paradoxical aciduria. In intra-IV hyperalimentation, we give fats, amino acids, and dextrose. A post-operative patient with pH of 7.25, mean arterial pressure of 60 mm of mercury is treated with fluid therapy with CVP monitoring. For a patient of gastric outlet obstruction, the OPD fluid management is normal saline and normal saline with potassium. Best vein for total parenteral nutrition is subclavian vein. Critical pH in Mendelssohn syndrome is 2.5. The commonest cause of water intoxication in surgical patient is due to excessive infusion of 5% glucose. Complications of total parenteral nutrition is hypokalemia, hypoglycemia, and hyperglycemia. Recognized complication frequently associated with enteral feeding is diarrhea and aspiration pneumonia. Consider the following: arginine, nucleotide, fatty acid, and glutamine. Which of the above immunonutrients are required more in the condition of stress? So all of these, arginine, nucleotide, fatty acid, and glutamine, all are required more in the condition of stress. A patient undergoes a prolonged and complicated pancreatic surgery for chronic pancreatitis. Most preferred route for supplementary nutrition in the patient would be feeding jejunostomy. Parenteral nutrition is not used in burns. It is used in enterocutaneous fistula, Crohn's disease, and ileus and pancreatitis. What is true about total parenteral nutrition? Lipids form 20% of energy source. Which of the following is not a complication of total parenteral nutrition? So congestive cardiac failure is not a complication of total parenteral nutrition. Metabolic bone disease, essential fatty acid deficiency, and hypophosphatemia is a complication of total parenteral nutrition.